everyone. Welcome to AICOG 2026 in Delhi. We have Dr. Aswath Kumar, who is our Chief Editor of OBGYN MD Course. So as we have newly updated the course with version 2, I would like sir to talk about the course, and there are few questions which I want sir to assist them. So thank you sir for being a part of
It's a pleasure always to be a part of DigiNerve and JP.
Thank you so much sir. Thank you. So my
So
first
about the course actually,
yeah.
We had designed this course 3 to 4 years. We have designed this course, and initially the course was planned in such a way that during our Corona days, the students cannot go to classes. So the basic aim of the course initially was to train the compensate the classes and points which could not be. So it's like a support system for your exam. So we planned, then we understood that the course has to be updated in a way that it is not only you have to pass, you have to score very high marks. So the initial course was just a baseline course which will help you to pass the exam. Now we have modified it to another level. We updated the course, and we want it to be a class. So you get the updation course within few days. It will be updated. So you will get the updated course with all the changes.
Thank you so much.
I'm ready to answer some of the few questions, queries you have come from the students. So,
sure. So, sir, my first question is are there any particular tough topics that are being covered here and the student can address them easily?
See, there is some change of the course started. When the course started, it was not in the era of super speciality. Now you should understand that everybody, the there is not a gynecologist or obstetrician. They are all super specialists. Okay. Sure. So if you take an obstetricist, they are either high risk pregnancy, they are fetal medicine consultants. If you take gynec, they are infertility specialists, or they are an laparoscopy, infant, or they are oncology. They are specialized in oncology. So we have to get focused. So passing MD was the aim of the previous course. Now setting up you into the next level is the aim of the present course. So that changes are what we have made.
So we can also say that it is from entry level to the exit level.
Exit level, and the practice. So they will take you out, and it is something like if you go through the course, you don't need a separate course for postgraduation super speciality. Go through the course, learn it, and learn the repeated questions out of it. That we have discussed in the super speciality part. They will easily, you will crack the super specialty, whichever, and you will be very happy to get whichever specialty you want.
Yeah, that's actually a good part. Everything is being covered at one place.
One place, that's it.
So my next question is, so how do you ensure that content stays evidence-based yet practical?
We went through all the guidelines. Actually, if you see the updated courses, we have followed ACOG, yes, RCOG, and FIGO guidelines, and all latest updates we are doing on it. So unless it's all evidence-based medicine now. So students should understand that any complication happens, anything happens, the court of law, if you are not done under the evidence. So evidence-based, it is nothing like current evidence for the exam. Okay. Previously, we used to write for exam, you read all recent advances, and practice differently. But if it is not possible now, that is why we planned in such a way that it's evidence-based. So that, and practically what changes that can be made also we are discussing. So in the Indian scenario, so we have included the FOXY guidelines also. So you take anemia, you take PIH, we have the gestosis score, we have explained like that. All the newer things we have added to it, and so that your practice in India or abroad becomes easy. And first aim is for us is to take you to the level. Then coming out also, this course will benefit you, not like other courses which is only for passing exam. This course, you can be with this course in the future also for continuing.
Great. And so is this course making residents ready for the real-time scenarios also?
Yes, we have recorded laparoscopy, we have recorded infertility and all these things. These are the things for the real time. So we have given importance for that also. So how do you approach a case? All these things, the case scenarios we are discussing. So that is all not only for the exam sake. We have discussed so many practical points.
We have Dr. Richa Saxena ma'am, who is our mentor, MRCOG, and also a contributor to OBGYN MD course in DigiNerve. So, ma'am, I would like you to please talk to our viewers and introduce how you have been into DigiNerve. What was your journey in DigiNerve?
So thanks Radhika for the introduction. As you already know, I'm the author for the books for 3 parts of the MRCOG exam. And subsequently, we also launched the course for MRCOG 3 parts. And many of you who have enrolled and if you have cleared the MRCOG, you already know about me. Probably you must have read my books also. And those of you who are aspiring to do MRCOG in future, you are requested to please enroll in our course.
Okay, ma'am. Thank you so much, ma'am, for introducing the offerings that we are having and all the academic part that we have. So, ma'am, right now we shall start with the discussing about MRCOG. That is the main course that you are offering right now. So, my first question for MRCOG part 1 is, what's the biggest mistake candidates make while preparing for MRCOG part 1?
So I think the biggest mistake candidates make is that they try to read everything and they don't revise and they don't solve the questions. More important is to revise the important facts just prior to the exam. Don't try to do something new before the exam. Try to revise whatever you have grasped or whatever you have prepared in the first few months and also practice as many questions as possible.
Okay. That's actually a great advice by mom. So, as we know, this is a basic, like part 1 is a basic science that we are covering. So, how should aspirants balance basic sciences with clinical relevance in part 1?
I think what the students should do is they should integrate the clinical knowledge. That is, when they treat the patient, they should correlate that with the theoretical knowledge as well as subsequently they should also solve the MCQs. For example, if you maybe say see a case of preeclampsia, so read theory related to preeclampsia, then solve the questions related to preeclampsia. That will give you a sound knowledge related to MRCOG.
Great. So, all those who are already listening to this video, so it is basically to go everything simultaneously to clear up your examinations. So, that's a glimpse of MRCOG part 1 that we have gone through with ma'am. Now, let's switch to MRCOG part 2. So, as it is a clinical knowledge and the application that has been covered in part 2. So, what differentiates a borderline candidate from a clear pass in MRCOG part 2, ma'am?
So what is important for MRCOG Part 2 is more of the GTG guidelines which the candidates should know about. And besides, again, the GTG guidelines, the theoretical knowledge pertaining to that particular subject, the clinical knowledge, as well as the knowledge related to the EMQs. So once you have grasped the GTG guidelines, then you should maybe solve the EMQs related to the guidelines. That will give you a sound knowledge related to MRCOG Part 2.
Okay, so as we are talking about guidelines, ma'am, so how should a candidate approach towards the guideline without trying to memorize them line by line?
So I think what they should do, because most of the guidelines, the GTG guidelines, the NICE guidelines, are available online, and you just need to have a general framework about the guidelines. Maybe remember the definition, maybe remember the red flag signs related to that particular pathology, the first line of management, maybe the next level of management if the first line of management fails, that is the escalation and the follow-up. So if you know all these, you are covered. So you don't have to kind of cram the complete guideline. These 4-5 aspects of the guidelines, if you know, you are through.
I will know what procedure is going on there. I think we are doing a case of adenomyectomy, and this is basically a operative OG. Are you PGs?
Yes, ma'am.
Oh, okay. This video program, this video course is actually meant for you all, where we have included all obs and gynae. This is not simple myomectomy, you see. This is adenomyectomy procedure. So yes.
Yeah, like this is they're going through vaginal route.
I know this is abdominal end,
route. Okay.
but planes will not be as nice as you get in fibroid. That is the problem. But in certain cases, you have no other choice but to do adenomyectomy. So when I was in PG, I had never seen a case of adenomyectomy. When I first time went to Taiwan for my training in 2014, there are so many adenomyectomy because women were not ready to get their uterus removed. Sometimes I ask my mentors that after removing so much, what is left there in the uterus? But it is your mindset and then scientific reasons also that ovaries, if the patient is just 40, her ovaries has to work till 65. So at least that 10 years you can give, even if it is not for childbearing. So then when I came back, I started doing adenomyectomy and I see that the craze in India also is increasing. Now our women also want uterine preservation. People are very like, and this week only we had one patient. She has actually, I think, uterus 14, 16 fibroids. She has nulliparous. She has undergone 2 myomectomies before with recurrence. She's 43 years old. But she is not ready for, like, it is a difficult case. And hysterectomy would have been so easy for us also, for her also, despite it. So the mindset has changed. Now patients are asking questions, even if you have made a surgical decision.
When you're doing BH, we have to remove there's hydrosalpinx and all, but she already has prolapse. It's better to remove that. Can you please explain about the procedure?
So vaginal hysterectomy, especially when you are doing for benign diseases without decent NDVH when you are doing, then removing tube and ovary is tricky. You should not think that, okay, the other person did, I will also do it. So you have to have some special instruments according to me. If you don't have any special instrument, at least take a right angle, which can hold. What are the problems if you are doing BSO and if infundibulopelvic ligament by chance slips? Then the ureter is second problem. First is patient will die of hemorrhage. Okay, because ovarian artery is the direct branch of aorta. And if it retracts, by the time you put trocar or open the patient would have bled directly from the aorta. So bleeding is the first problem. Second, when you are attempting to catch again and again, then definitely you can injure the ureter also. So these are the two problems. So I always say that whenever you do, you should have special instrument. And at the moment, my favorite instrument is Biclamp. Okay, so you just hold it backbox and bit by bit you keep on doing. So it keeps on coming in your hand. Okay, only thing you have to remember in Biclamp that energy spread to bowel because uterus is already removed, bowel is exposed. So you have to keep a gauze piece to make a barrier between this thing, and you should not forget to remove that gauze piece. Otherwise, it is going to be gossipoma will become. Okay, much more medical legal complications now, so that should not happen. So that is, otherwise you can use, there are some loops, suture loops come. So you hold it with Babcock's and put your suture loop, tie the knot like extracorporeal knot, and then you can do. Otherwise, you can just, my favorite as of now, I don't know, tomorrow I might get to know some new technique, but as of now, Biclamp is my favorite.
Thank you.
Sir, so thank you so much, sir, for answering these questions, and it will make easier for students to learn. Anything like last minute advice you wanted to share with our users?
See, last minute advice is that, see, if you have gone regularly through the course, regularly, that means how you utilize this is that every day there will be topic discussions and teaching sessions will be going on in your hospital. So for example, you have a class on breech position, you have class tomorrow, you are asked to present, so you go and take your case and listen to our course, then go and present, then you will learn. Not only you, the person who is presenting, tomorrow everybody knows there is a class on breech, everybody can listen to this course, then you will get all the common points and your teacher may add some extra to it. And even many of the teachers are using our course. Actually, they are listening to it and coming to classes. So I know my colleagues and all our teachers are many teachers more than the students are following our course, because this is easy for them to teach.
Yeah, because you may realize when they talk about it. So that's all for the questionnaires that we have today, sir. Thank you so much for being a part here and attending with us the AICOG for today. So thank you so much all. Thank you, sir.
Thank you.
So ma'am, as you're also a faculty in OBGYN MD course, there are few questions related to it. How do you envision version 2 helping learners transition from theory to practice?
So version 2, now we have come up with many new additions, many new changes in version 2. So previously, I think there were 160 topics. Now the number of topics crosses 290, I believe, and the video hours have also increased by more than 100 or so. So we have added new videos in form of super specialties, because we realized that the students, they also want to have knowledge related to super specialties. So now we have added urogynecology, we have added histoscopy, laparoscopy, gynecological oncology, we have added endocrinology. Plus, we have also now tried to curate the course in terms of NEET assess exam. So we have a very vast question bank, which presently has about 6,000 questions, but this is in the process of further updation, and this will help the candidates for their NEET assess exam. Besides that, we have videos where we are discussing about the high yield topics, the high yield questions. We are also planning to organize regular chat shows, and I think the schedule starts from January, and January to July. Now, consecutively, every month you'll be having a chat show. That is something which will help you brush up your concepts and also interact in real time with the mentors of the course and gain real time knowledge from them.
So as we are bringing more interactive sessions in the course, it is going to help to the users also. So how do you see OBGYN MD evolving with new technology or medical advances?
So if we talk about medical advances, then we have tried to incorporate all the new guidelines, and especially in terms of oncology, the latest guidelines, the latest developments, the latest staging systems in the various carcinomas have been included. And if we talk about technology advancements, then everybody is talking about AI nowadays. So we have incorporated our doctor-wise course, the OBG MD course, and we have, I think, around 35 to 40 books from JP, which are high-level, high-ticket titles. And when you put a query on DoctorWise app, it'll curate out the answer from all these books. So I think this is one of the greatest advantage of technology which we have extrapolated to our course.
Are there any hidden gems in version 2?
So I have already spoken about the various features, but one feature which I think I missed, and I think it is a hidden gem, and I think all the students should talk about it or should go through this, is there are 25 case discussions videos which are there in the course, and these are pertaining to case discussions of important cases which you encounter in your exam, and there is a discussion which happens between the faculty and the students, and this makes the videos very, very interactive and exactly towards what you face in your Viva exam. So I think this is a hidden gem, and this will be extremely useful for the students.
Thank you so much, ma'am, for bringing all the insights of OBGYN course 2. So thank you so much,
My
everyone.
pleasure, Radhika.
Thank you.